Assalamualaikum dear students, this is week 14 and I Dr. Tamkeen Saleem welcome you to the lecture on topic obesity and eating disorders. The learning objectives are that student will be able to learn what is bulimia, what are the cause and factors for developing bulimia and what are the treatment available for bulimia, how it is different from binge eating, what is binge eating, what are the causes of binge eating, as well as what are the treatments available for binge eating. Bulimia means continuous morbid hunger. This distinguishes bulimia from anorexia as impulse control. There is lack of impulse control. Bulimia has come to mean more than continuous morbid hunger. The chief identifying mark of this eating disorder is repeated binging and purging. The purging usually comes after eating huge quantity of food, and usually that food is high in calorie. DSM defines bulimia nervosa as involving recurrent episodes of binge eating, a sense of lack of control over eating, and inappropriate drastic measures to compensate for binge, that is usually purging. Some bulimics fast or exercise excessively, but most use self-induced vomiting or laxatives and maintain a relatively normal weight. Bulimia is more common in women in comparison to men. Bulimic often experience problems related to impulsivity, such as alcohol or drug abuse, sexual promiscuity, that is, having multiple partners, suicidal attempts, stealing or shoplifting. Their childhood experiences include abuse and post traumatic stress, and probably in order to cope with these things, they indulge in the behavior of eating more and more, which transform later on in bulimia. And there can be also psychological factors like depression and anxiety. Treatment for bulimia has a critical advantage in comparison to the programs that are available for anorexia nervosa. As anorexic are not ready to get involved or go for the therapy, bulimics are more likely to be motivated in order to change their eating behaviors. CBT is considered to be an effective modality. However, interpersonal psychotherapy has also been successful in treating bulimia, which focuses on present interpersonal problems and not on eating, taking the approach that eating problems tend to appear in late adolescence when the interpersonal issues present major developmental changes. Thus, eating problems represent the maladaptive attempts to cope with the problems in the adolescent era. Similarly, drugs can be taken. For example, Prozac is commonly taken for treating bulimia. Binge eating is also compulsive in nature. It's the same type of out of control eating that is symptomatic of bulimia, but without any form of purging. So there is only the episodes of eating large quantities of food without any purging, or that is vomiting. The question is that who are the binge eaters? Binge eaters are more likely to be female again in comparison to male. Eating is more common among men than anorexia or bulimia is. It is present in all cultures and all ethnic groups across the globe. Binge eating is more common than anorexia or bulimia nervosa. Its prevalence is 2% of the population, and the presence of personality disorder is considered to be one criterion that distinguishes binge eater from those who are obese but do not binge. Treatment for binge eating, just like other eating disorders, cognitive behavioral therapy is effective for binge eaters as well because it helps in controlling the binge eating behavior, but it is not much effective in promoting the weight loss. Binge eaters are not good candidates for weight loss surgery. This drastic intervention does not help in managing the binges for them. However, there can be usage of drugs which may produce a significant decrease in binge eating but do not prompt the weight loss. For example, SSRI or antidepressant drugs like Prozac, which are helpful in relieving the psychiatric problems.